Welcome back, everybody. Today we're going to talk about our next product in line. So this product's been around for probably 10 or 15 years. It was really one of our first biologics that we had. So this fits in a category called an orthobiologic, which is just simply a biological approach to controlling orthopedic disease. So IRAP stands for interleukin-1 receptor antagonist protein. We're going to keep it simple, call it IRAP. So how does that work? So when the joint produces interleukin-1, it has to bind this receptor to continue this cascade. The IRAP protein is naturally produced by the horse, and it's going to go in and actually block this receptor. So as the interleukin-1 is being produced, if this receptor is blocked, it cannot bind to the receptor. We don't get these downstream effects. We break the cycle. There's a few other things that are in IRAP. We have low levels of growth hormones as well that actually help heal the joint. So let's go to the lab and let's show you how we actually process and how we make IRAP. So we've been talking about IRAP today. So if we feel like your horse is a candidate for IRAP therapy, how do we do that? So we're going to start off by sterilely prepping the jugular vein. At that time, we're going to harvest 60 mils of whole blood using the syringe. After harvesting, it'll be in this tube. I don't know if you can see, but there's little small beads in here. These are chromium beads. They help to upregulate the expression of the IRAP protein. So once we get that pulled, we're going to bring it back here. It's going to go into an incubator. It's going to be in that incubator for approximately 16 hours. After 16 hours, the IRAP will come out. It'll go into the centrifuge. It'll be spun down, and we'll actually harvest the serum or the liquid portion of the blood out of this tube. From there, we'll divide it up into individual syringes. The dose can vary from 3 mils to 5 mils, depending on which joint we're treating. Once that's done, it is put in a freezer, frozen. We're going to do a series. So typical injection series will be 1 injection every week for 3 weeks. After that, we'll booster as needed. So that's the basics of IRAP. Again, keep sending your questions, and we're going to talk about ProStride next week. Thanks.